South Africa is once again at the center of a heated national debate. At the heart of it, public health care, undocumented foreign nationals and constitutional rights. Who gets access and who decides? Let's unpack the latest statements from both the South African Human Rights Commission and Actionsa. The Commission has strongly condemned any attempt to block individuals from receiving emergency health care based on nationality or immigration status. According to the South African Human Rights Commission, such actions are not only unlawful and unethical, but also violate both the South African Constitution and international human rights standards. The Commission is deeply concerned about reports of individuals or civil groups taking the law into their own hands by trying to prevent foreign nationals, especially undocumented ones, from accessing clinics and hospitals. The South African Human Rights Commission reminds the public that only the Department of Home Affairs, along with SAHRC, has the legal authority to address matters of immigration and documentation. No private citizen or group is legally allowed to deny others access to health care or enforce immigration laws. They further emphasize that healthcare professionals are bound by ethical duties to treat every patient with humanity, dignity, and impartiality regardless of legal status. The South African Human Rights Commission also acknowledges serious challenges within South Africa's healthcare system, including staffing shortages, long queues, overcrowded hospitals, and limited resources. They call on both national and provincial departments of health to urgently address these systemic issues without violating the human rights of anyone seeking care. And they are clear, using these challenges as justification to block or discriminate against others is not only dangerous but also unconstitutional. In a media release issued by Parliamentary Chief Whip Lerato Ngobeni, Actionsa reaffirmed their position that the public healthcare system is being abused by illegal foreigners. They argue that Section 27 of the Constitution, meant to protect the right to health care, is being misapplied in a way that places unbearable pressure on already stretched public services. According to Actionsa, over 70% of patient files at one Johannesburg clinic reportedly belong to foreign nationals. They describe this situation as unsustainable, especially when law-abiding South Africans struggle to access care. They propose constitutional amendments to prioritize South African citizens while still fulfilling humanitarian obligations in a lawful and sustainable way. The South African Human Rights Commission prioritizes human rights, non-discrimination, and ethical medical care for all, regardless of nationality. Actionsa emphasizes national responsibility, resource protection, and immigration control to ensure citizens are prioritized. Both parties agree that the healthcare system is overwhelmed, but they differ on the root causes and the solutions. The South African Human Rights Commission has warned against vigilantism and urged members of the public not to block access to hospitals and clinics, calling such actions a violation of human rights. They advise anyone frustrated with the system to raise their complaints through formal legal channels or to report systemic issues directly to the Commission. Actionsa, meanwhile, has called for law enforcement to ensure that South Africans' rights are not sidelined and that public resources are not exploited without accountability. What's clear is that the issue is bigger than just politics. So I'm going to go ahead and read you guys some of the comments that I saw online under the Human Rights Commission statement. So this one says, are you aware that I cannot go to any clinic in South Africa, but I must go to my local clinic before I can be referred to a hospital? But that legal procedure does not apply to undocumented immigrants. They have a right above South Africans because they can go to any clinic anytime they feel like doing. that causes problems because they are now stealing medicines to be exported to their countries. So how are you going to address that? And then this one says, before clinics are built, a study is conducted to check the population of communities. Thereafter, the Treasury allocates funds based on that population, meaning illegal immigrants are not accounted for. And then this user says, this is not gonna fly. Immigrants are required to have travel medical insurance in their host countries. Why must South Africans cater to foreigners for free? What do you think? Should healthcare access be universal, or should stricter controls be in place for undocumented individuals? Let us know your thoughts in the comments below, and remember to like, share and subscribe for more updates on South Africa's most pressing issues. Thank you for watching. I'll see you on my next upload.